They call themselves violence interrupters. Their goal isn't just to mediate conflicts when they arise, it's to understand what's behind the rise in violence in their neighborhoods and find solutions to address it.
Violence is not one issue, it's a layered, complicated disease.
The things that lead to violence in communities tend to be the same things that are social determinants of health.
For 2 Maryland jurisdictions, this is a public health mission. This morning, we sit down with the team behind Safe Streets, plus the new program Anne Arundel County is unveiling in the Eastport neighborhood.
It came up, I told my officers I wanted them to walk foot. Well, they immediately thought I wanted crime stats. I wanted car stops and field interviews. It's like, no, I just want you to walk in the community and talk to people.
Sure. And later, a frank assessment from Baltimore Police Commissioner Richard Worley. He explains what needs to be done to build trust between officers and residents. That's all this morning on 11 TV Hill. And hi everyone, I'm Jason Newton. Welcome to this edition of 11 TV Hill. The concept of violence interrupters is not new. However, more and more cities and jurisdictions are adopting the models. Such is the case for Anne Arundel County, which just announced a pilot program in Eastport. Like Baltimore Safe Streets, this is run through the lens of public health. We'll talk to the county's health officer a little later in the show. Now, Baltimore launched the Safe Streets program back in 2007, and the last 17 years have seen major growth for that initiative. Joining us now is the Vice President of LifeBridge Health's Violence Intervention Program and the Executive Director for the Center for Hope, that's Adam Rosenberg, and the Director of Community Violence Intervention Programs at the Center for Hope, Freedom Jones. Good to see you both.
Good to see you. Good morning.
We are used to seeing hospitals on the other end of violence. You guys are helping to get people back on their feet, but now you want to prevent them from even coming to your front doors. How does this all work, and why get involved on that end?
You know, one of the primary drivers of LifeBridge Health and our 5 hospitals and our thousands of providers in the community is to really keep people out of the emergency room and to keep them healthy. When we've polled our neighborhoods and asked them what their top health concerns were, in addition to heart disease and diabetes, violence was one of their concerns. In response to that, we've been able to take all of our violence prevention programs from child abuse and domestic violence and elder abuse and community gun violence and put them under the umbrella of Center for Hope. And this is our effort to prevent people from becoming victims of violence. The best indicator of that has been over the last year and a half of these programs being together, or 6 Safe Street sites, we've been able to see a astonishing 28% reduction in gunshot wound and penetrating wound admissions at the emergency room. So there are fewer people in the emergency room there. And it's an indicator that our work, along with the work of a lot of city partners, is helping keep people safe and keeping them from getting hurt.
Freedom, what's the difference maker on the streets? I mean, you see the Safe Street sites, and you see the gentlemen and women out there. What are they doing differently to keep people from walking in the front door?
It's not about what they're doing differently, it's about what they're doing consistently. So Safe Streets, as you know, is a program that is designed to work with the highest risk, the folks that are likely to cause the highest risk on the streets. Sure. So the beautiful thing about our programs is that we have interventions at bedside with gunshot victims. We have folks on the streets who are mitigating high-risk incidents. We have programs that are addressing the trauma that people have witnessed based on their experiences around communities that are plagued with violence. And this is kind of a concept that is really strengthening. It's strengthening in our country. I have the privilege to be a part of the Community Violence Leadership Program, which is a public health initiative. It comes out of the Chicago School of Public Health that has gathered 31 different cities to really look at how we're doing this work. And we're really happy. We're presenting to the White House next week for our graduation. But the key thing is this. We are now a part of an ecosystem. Violence is not one issue. It's a layered, complicated disease. And we're looking at this disease as if we have this ecosystem and a group of partners that are working cooperatively, we can address and intervene at a street level, at a bedside level, and at a level that will mitigate risks of incidents.
I think when people think violence interrupters, they suddenly think of a superhero. You think of Superman land and everything is all right. But this is something that takes work over time. I guess you can't just helicopter in and suddenly we've solved it.
That's right. Yeah, go ahead.
Violence interruption, you have guys who've been there, done that, credible messengers. So they know where the violence, because they're like doctors. They've been trained on the streets. So you imagine someone who knows their community, who is willing to jump into a fire. So when I say a fire, they're willing to intervene based on their relationships. Interrupters are about having relationships to say, you know what? I know you, you know me, look at me. Don't do maybe what I did, let's do better. And so they're risking themselves. So I think they're superheroes
Yeah.
because everybody wants to run into a fire.
Sure.
So I commend and I'm very proud of the work that we're doing. I look forward to leveraging our programs so that we're fully staffed, so that we can serve the most highest risk in Baltimore.
Sure, Adam, jump in. When you see some of the results, I'm guessing you're sort of that proud papa moment that you see that this can pay off.
These programs work. I mean, there's been ample studies that Daniel Webster at Hopkins has shared. There's national results there, and we're seeing these results locally that these programs pay off. It takes patience. It's taken a long time for Baltimore to have a city that has the Orioles, that has 101 wins there. That doesn't happen overnight, and I think community violence interruption work takes time to do that as well. And look, we've been in this game as LifeBridge Health for 150 years, saving lives, healing people. We've been doing child abuse prevention work for over 30 years there. We've been doing domestic violence prevention work for 20 years there. Yeah. And so it's just a natural progression for us over the last 5 years to be really involved in the community and addressing the needs that they have there. And we're starting to see those results pay out.
The commissioner's coming in a bit, have a minute left here. Just tell me about the idea that this has to be a holistic approach where everyone is involved and the importance of that idea.
Yeah, you know, the beautiful thing that I've learned as a result of connecting with 31 different cities around this work is that we have to do this cooperatively. So we have to work as an ecosystem. You have to address violence from the street level to the resource level to the training level to the strategies that allow us to do this work from a place of collaboration. And so our guys and men and women on the street, they're not just immersed in the street without training. They're not immersed in the street without supports. Can you imagine going into a fire and taking on that heat every day and every day without getting the therapy that you need as a worker? So we're looking at these strategies so that we can strengthen our staff. I'm very grateful to be working with LifeBridge because we have a mini ecosystem at the Center for Hope. We have mental health programs. We have programs that deal with trauma. We have vocational workforce readiness programs. We have a mini ecosystem connected to the greater ecosystem that the mayor's office has been bringing us together to develop.
All right, Freedom, Adam, good to see you both. Thank you for coming by.
Thanks for having us.
Certainly.
Thank you.